Our series, Changing the Game, highlights extraordinary women. Did you hear that part? Extraordinary women making a difference. It's Breast Cancer Awareness Month. We want to introduce you to one woman trying to make a difference for those fighting the disease. And boy, is she working overtime on this. Her name is Amanda Rice. She's a founder and CEO of Chick Mission. Think of that name, that's going to be very relevant in just a second. She's a two-time breast cancer survivor and a skin cancer survivor. That's right, Tony, two-time. Chick Mission helps young women who have been newly diagnosed with cancer preserve their fertility. So this is when a person's eggs are removed and saved before treatments that can cause infertility. Chick Mission works with 35 fertility partners in 8 states, has helped families save more than $7 million in fertility preservation costs. Amanda Rice, bravo, bravo to you, and welcome.
Thank you, guys.
How did your own experience, number one, I bow to you. 3 cancers before the age of 40. Wow.
Yeah.
Wow.
Somebody's looking out in your life for sure. Whew. How did your own experience, though, lead to this?
Yeah, I mean, when you're diagnosed with cancer as a young adult, it is very isolating.
Yes, and devastating.
Most of the people you know are postmenopausal. They've already lived these long lives thus far, and it doesn't mean it's right to be diagnosed with cancer. It's just very unique as a young woman, especially. I was a working woman in New York City, working in finance, and all of a sudden stopped in my tracks by those 3 words. And ultimately, I was one of the lucky ones. I was a woman who worked in finance, a white woman, a privileged woman who had access to great care and phenomenal doctors who told me about the risk of infertility. Ultimately, that's something you have to think about before you even start treatment, if you want to have biological kids one day.
And then when you went to freeze your eggs, you found out that it was not covered by insurance. You had to pay for it, and it's very costly.
Very.
Incredibly costly. And I had fertility benefits at the time. But when I went to freeze my eggs, the insurer told me I wasn't infertile yet.
Uh-oh. Wow. How old were you then? How old were you?
I was 38.
Mm-hmm. Well, so only 18 states offer to pay for fertility coverage.
Right.
You've advocated for more states to require coverage for cancer patients, but you've also been instrumental in changing the law in one state. Tell us about that, because that's huge.
Yeah, I mean, there is a broader coalition across the country, different organizations that have band together. This past year, we worked on Oklahoma with a group of survivors and in honor of somebody that we lost, Corinne. And we worked in Oklahoma, found some authors, and ultimately were able to change the law this year.
Go ahead.
I was going to say, talk to us directly about this mission of Chick Mission, where the name comes
from. And the
from.
name.
Yeah, the name, and then the future of it.
Yeah, so we're a triple threat mission. So we give need-based grants. As soon as you're diagnosed, it's a whirlwind of information. So one of the things, hopefully, you are told is that there may be an impact on your future fertility. So we cover these grants for women that are aged 18 to 40, any type of cancer, but predominantly given the prevalence of breast cancer, those are our patients. Mm-hmm. They are given a small window to freeze their eggs. We don't have them go out of pocket. We reimburse the practice.
Wow,
so
Amanda.
we can just take that burden off of them.
So someone listening to you right now is sitting in tears going, oh my gosh, maybe she can help me. Who's eligible? How do they get in contact with you? How does that part work?
So we receive DMs on Instagram. We get contacted on a daily basis from those that have just been diagnosed or have completed treatment. So we say, reach out to us. There are a ton of resources. They're not all in one place, but if you live in the 8 states where we currently work, you're diagnosed, you haven't started fertility threatening treatment yet, you make under $150,000 per year. They're need-based.
Okay.
Wow.
We're gonna cover your fertility preservation.
Wow.
And your health today, before we go?
I'm great.
6 years in remission.
That's right.
Congratulations.
You can see how important
Thank
this
you,
mission
Amanda.
is to you. Yeah,
Yes.
thank you. And now we understand why.
Yeah.
Amanda Rice, thank you very much.
Absolutely.